Welcome, Dr. Kasasa, and thank you for being with us for this episode on oral health and diabetes. You're extremely experienced in both aspects of oral health and as a researcher in terms of things like infection as well, I believe. So, a lot of people don't know that there is any link between diabetes and oral health. Would you like to say a few words about that, first of all?
Thank you very much for the invitation today, Joan. It's an absolute pleasure to actually come and share on oral health and diabetes. Yes, most people don't really connect the mouth with the rest of the body. They see it as a completely separate area of the body. The body is the body and the mouth is the mouth. But in actual fact, to me, the mouth is really the gateway to the rest of the body. And most of the things that are connected in the mouth also connect to the rest of the body, apart from the fact that we eat food and it then transfers into the rest of the body. So we nourish ourselves through the mouth. But nonetheless, the conditions in the mouth or the conditions in the body can actually be seen to have an impact on both systems. So diabetes is definitely something that can actually have an impact in the mouth. But similarly, in the mouth, any diseases of the mouth can actually impact somebody who's got diabetes as well in the general body.
Thanks so much. So let's talk first of all then. So you're saying it's almost like a two-way process. So in terms of the manifestations of diabetes that would be seen in the mouth, can you give us some illustrations and elaborate on that a bit?
So, if you look at the mouth is obviously, when we're talking about dental disease, we're talking about the teeth, and we're also talking about the tissues in the mouth. So, we're talking about the cheeks and the gums and the tongue, but also the supporting structures of the teeth. So, when there is diabetes in the system, the fact that there is a higher blood sugar level will then also transfer into the sugar level in the saliva. And since the saliva is bathing the mouth and the teeth, so the increased sugar in the mouth in response to the teeth can actually increase the incidence of tooth decay, because decay is based from the sucrose and the sugar element in our diets, but also the fact that it's in the saliva is actually washing around the teeth. So that could increase the incidence of dental disease in teeth. But also diabetes, the fact that it's the sugars in the circulation, it actually is a condition that actually has delayed repair. So the healing is less optimal in someone who has diabetes. Therefore, if there are conditions in the mouth where there might have been, in normal cases, the immune system would repair the tissues and the body quite well, and the inflammation would reduce and maybe go away. In this case, where someone's got diabetes, the chances of repair is a little bit delayed. And therefore, because the healing is delayed, there is more likely that diabetes would exacerbate that particular oral health condition or oral health disease that's present at that time.
So you've given us this, it's quite a startling picture, really, of almost like a sugar mouthwash. That there's this sugar bathing into the saliva. So constantly there's this, if the blood glucose levels are high, there's sugar in the mouth, which is going to affect the teeth. You also mentioned things like the gums. You also mentioned things like the cheeks. How would it manifest in those areas as well?
So particularly in the cheeks, you can get certain conditions. So sugar obviously can increase the incidence of getting thrush, fungal infections. So on the cheeks and some of the soft tissues in the mouth, you can see white patches, which are usually indications of some kind of thrush or fungal infection. But apart from the cheeks, there's also areas like the gums and the bone beneath the teeth, which actually supports the teeth. So if there is poor repair or poor healing, because we've got bacteria in the mouth all the time, it's reduced a little bit with toothbrushing and better oral hygiene. But generally, because we've got bacteria and certain bacterial species manage to get underneath the gum, and therefore, because they're in that environment, they can actually destroy the tissues underneath the teeth, and therefore, by destroying those tissues, you can end up having tooth loss. And so that's how it actually impacts the mouth in both the cheeks and the gums and the bone.
So it can affect the gums, it can affect the underlying bone, it can affect the cheeks, it can affect the teeth, it can affect the healing. So having multiple impact on the oral health. And is it everybody who's living with diabetes who would have these effects to some extent, or is it when the blood glucose levels are too high?
So generally, the diseases of the mouth are quite common in everyone. So whether it's the teeth or whether it's the supporting structures and the soft tissues in the mouth, they're quite common. The issue becomes real if somebody has got uncontrolled blood sugar, because then it means that it's beyond the normal levels or what's considered the optimal level. And in these kind of circumstances, the incidence is much higher for the disease in the mouth or the disease in the mouth to actually impact the diabetes. So it leads to weakening of the insulin response, and therefore it makes diabetes harder to control, just because of the fact that it's come from the mouth, and that's had an impact on the blood sugar, which means if it's harder to control, it then feeds back into the system of the mouth, where the sugar increase now is likely to cause dental disease or oral disease.
So, I mean, as clinicians, we would know that if somebody had any ongoing infection, that can have an impact on their diabetes levels, their blood glucose levels. And you've just highlighted to us how if there's infection going on in the mouth, that can equally have an impact on their blood glucose levels, on the person's blood glucose levels as well. And I think quite a lot of people, that would be new information for them, because, as you say, there's that disconnect between think of the mouth as part of the body, and having an infection somewhere else in the body. So you've noticed as a dental and oral surgeon that if somebody has this oral ill health, if I can call it that, that it can impact their blood glucose levels as well. Is that the case?
That is definitely the case. You definitely see that it's then harder to actually control the blood sugar levels, because of the fact the oral diseases in the mouth have an inflammatory origin, and that inflammation seems to affect all the other systems in the body as well. So yes, definitely.
So, we always want to look at any possible preventative actions we can take. Um, Prevention, as they say, is better than cure or trying to cure. So, in terms of oral health, what would be the preventative actions that one could take to try and prevent this sort of vicious cycle of effects?
So generally speaking, keeping your mouth in optimal health is paramount. Most people don't really think about this in particular, but the best way to make sure that you keep your mouth in optimal health is firstly to visit a dentist on a regular basis, so that anything that's actually taking place before you are aware of it is actually picked up. So regular dental visits whereby they actually examine the teeth and examine the oral tissues generally, and so can pick up things much earlier and then treat them if necessary, but also give you the necessary advice to prevent ongoing problems. The other thing that's relatively important is actually own personal oral hygiene. So most people know about brushing their teeth. We all know we should brush our teeth. But there's a difference between brushing your teeth and how many times you brush your teeth or how you brush your teeth. So this information is quite important to actually get it right. But also, in so doing, it's also looking at different aids as well as brushing your teeth. So, for instance, interdental aids that would actually clean in between the teeth, because these are areas where there are little pockets where the bacteria can actually stay. And furthermore, apart from actually doing that, is making sure that your diet is obviously also in the right place, so that the kind of foods that you eat are not going to actually increase the chance of you getting any dental disease, or actually impact maybe your diabetes as well. So it's really a combination of things that are really important for people to do on a daily basis, on a regular basis, to make sure that prevention is definitely better, because some of these situations can actually be treated early enough before they become a very serious infection, because in some cases, the diseases of the mouth become chronic. Once they become chronic, you're almost in an irreversible stage whereby some of these conditions cannot now go back to what normal or optimal health is. You now can lead to tooth loss, and which is a significant issue for most people, because it affects being able to eat, it affects being able to smile, it affects speech, and generally, you can lead to a lot of pain as well of that.
Yeah. You've given us so many aspects of prevention there. So can we maybe look at that in a bit more detail? So in terms of going to see the dentist on a regular basis, if you're living with diabetes, would you suggest that somebody who's living with diabetes needs to go more frequently, or do they need to go as regularly as everybody else?
I think it's important to go as regularly as everybody else, because you don't want to actually, put them as a special case, because they aren't a special case. It's really maintaining your good oral hygiene and good oral health. Having said that, if there's ever any indication that the person is actually recognizes something different, for instance, bleeding gums, if their gums started to bleed, then that's a reason not to ignore, but to actually go and seek some dental advice, or to go and book an appointment to actually check this a bit earlier, because again, this could be an indication of something underlying, something going on. Another thing that someone could actually check is maybe there's a changes in their breath. So people might get bad breath and think, wait a minute, this that might have, sometimes it's their partner who actually tells them. But if that is also highlighted, again, it's important to go and check. The issue mainly is that people sometimes ignore these signs and don't actually do anything about that. But if you do go, then obviously it's picked up again early enough, it's addressed, it's treated, and you're back into optimal health.
And as an individual, then, by the same token, do you need to be brushing your teeth using those interdental brushes or flossing more frequently than people who are not living with diabetes?
So I think oral health and looking after your mouth is really, there's certain things that everyone should do. If you have a particular type of diet, for instance, if you eat a lot of soft foods, you may have to clean in between your teeth a little bit more than somebody who doesn't. But overall, if your diet is quite a good diet, and again, it's important to address that, because that actually impacts the foods in your mouth and what the bacteria does in your mouth. But overall, if you're brushing your teeth the way you should twice a day for 2 minutes, and actually used interdental brushes, the education around this is the thing that's lacking for most people. And because they don't know this or they don't do this, you find that they're more likely to get the incidence of oral disease. So I wouldn't necessarily say that because you've got diabetes, you should do something different. But it just means that you need to do the normal things, which is the brushing daily, twice a day, looking at the diet, looking at the foods you eat, and actually using interdental aids as well.